Tonight, we continue our series Seeking Solutions, hoping to help address homelessness, mental health, and substance abuse issues in our community.
Wichita State researchers looked into the high cost of treating those with unmanaged care. KSN's Hunter Funk has the story.
The WSU study investigated high utilizers. These are people who suffer from mental illness or substance use disorders whose needs aren't being fully served through the current behavioral health care system. Researchers looked at the costs for Extension Via Christi St. Joseph, ComCare, and the Substance Abuse Center for Kansas, or SAC. These are individuals who regularly cycle through the emergency department, crisis services, detox and sobering, and are often uninsured or underinsured. And they end up back on the street without fully managing their illnesses, and they start the cycle all over again. Now, the WSU study investigated just what that costs our community.
These are complex individuals. These are people who have decades of trauma.
And they just circle and cycle through all the different levels of care in our community and in our state, and don't ever get exactly the right level of care that they need because it no longer exists.
With the growing behavioral health crisis, in 2015, the Kansas Health Foundation gave Extension Via Christi a grant to study these high utilizers. The goal, find the gaps in services and find out how much they're costing the community. Wichita State University's public policy and management staff did the research. Researchers analyzed data from 2015 to 2018, studying 519 high utilizer cases from all three organizations.
We're seeing them in the hospitals, we're seeing them in the mental health centers, we're seeing them receive substance use disorder services.
The first finding, 25% were high utilizers of more than one organization.
There is a high crossover of these individuals.
Next, the cost. Between the three organizations, the utilizers received nearly $56 million of care over the 4 years. $17 million of that was paid through taxpayer-funded services like Medicaid and Medicare, other grants, and donations from the public. Breaking down the cost per person, in 2018, the median cost was more than $72,000 for each patient at the hospital, $20,000 for ComCare, and $1,000 for SAC.
And what it has clearly indicated and shown to us is there are huge gaps in care.
The study found that once a high utilizer was released from care,
They're feeling good, they discharge from the hospital, they don't want to see a mental health professional the same day or the next day.
it also found that wait times to transfer patients to longer-term facilities were too long.
We're lucky if we can get them to hold that thought long enough to get them transported from here to a facility. 2 months, never mind.
Since the study was released in 2019, it's prompted more collaboration. The three organizations have come up with a shared crisis plan to more effectively get high utilizers help. It also kickstarted the Substance Abuse and Mental Health Coalition.
If we could have services in place that take care of people and address the needs they have, it will save tax dollars for the state, and it will save money for our hospital system, which then in turn frees up space for other people who need emergency services.
The coalition is continuing its work and considering several initiatives. That could include a centralized area for services to come together, finding a space for ComCare expansion, and piloting new programs such as a system that shares patients' information between organizations. Hunter Funk, KSN News 3.